Okay, welcome. Thank you all for being here. Today's session is Administrator Education. So my name is Courtney Whittington and I work at the Church Pension Group. And throughout the year, I work with Annalyn and others at the Diocese and others at other dioceses to manage benefits, help when something goes bump in the night, which we hope doesn't happen too often, and then provide support around annual enrollment and renewals and educational sessions like this one. So tomorrow we have a member education session. So if you're wanting to really dive into the details of the medical plans themselves and the benefits in the nitty gritty, that will be tomorrow at 3:30. This session is going to focus on what you need to know as administrators and some kind of high-level strategic topics so you can understand kind of where your rates came from and what you need to know to support your folks in making their decisions coming up here really soon. So, okay, there we go. So today, we're going to start with some benefits updates. It's all good news. And then we'll talk in more detail about our pricing process and your rates specifically. Then we'll talk about annual enrollment and what you need to know as administrators. And then we have this amazing health benefits information booklet that Annalyn helps me put together each year. So we'll go through that briefly so you have an idea of what's in it. Excuse me. And then we'll talk about some other coverage and some resources for you, and then we can have time for questions in the end. So this session is scheduled for an hour and a half, but I don't think we're gonna need the whole time unless you all have a lot of questions, which hopefully means the time is very valuable to you. So if you have questions as we go through, there is a chat. It's a little hard to kind of talk and present and keep my eye on all the places. So if I don't see your question right away, bear with me. But also feel free, I muted everyone just for the sake of simplicity, but if you have a question, feel free to unmute yourself and just interrupt me at any point. I'm totally fine with that and happy to answer your questions as we go through. And I'll also stop along the way and ask and make sure that everyone's tracking with me. So let's start with benefit updates. And the first one is I want to make sure that we spend a little bit of time reviewing everything that CPG has done this year to support us all in this COVID-19 landscape that we find ourselves in. So the first thing is clergy pension waivers. And this is a program that was started, well, actually our board the board of directors created this kind of mechanism in the event that there was an emergency like this. So the groundwork had already been laid for us to be able to offer these clergy pension waivers years ago. And what we did in the spring was offer 2 months of clergy pension waivers to those who can demonstrate financial need. And those applications all go through the bishops. And then we extended that to a maximum of 4 months. And as of now, there's no deadline on when that program will end. It will eventually end, but it's open for now. So we've had a very positive response to that. The second thing we did was we had a 90-day grace period over the summer. So maybe you didn't want a waiver or didn't need a waiver, but maybe you just needed a little more time to pay the pension assessments for the clergy pension plan or the lay defined benefit plan, or a little more time to pay those medical, dental, life, and disability insurance invoices, or the property and casualty insurance was also all of that. We gave you an extra 90 days to make those payments. And that grace period has ended. As I imagine most folks on the call know, we are not a nonprofit, so we have to cover those expenses somehow. And we'll talk a little more about the impact of that on the medical side in a little bit. But that 90-day grace period also helped out a lot of folks. And if you're in a situation where you've gotten a little bit behind, please reach out to our client services team, and they're working with folks to create payment plans and make sure you get caught up, in a way that's manageable for you. And then Another COVID-19 thing was and this was in response to some IRS guidelines and legislation, but allowing for mid-year plan changes. So maybe you found yourself, last year during this time, you signed up for the PPO 100 and you realized, now that you're not using that plan as much as you thought you would, and you're paying a little bit extra to be in that plan. So we are allowing folks to make changes prior to the end of this year. So annual enrollment will be for January 1st, 2021. But if you or one of your employees is in the situation where they would really like to not be buying up into a more expensive plan, they can make that change for the future. So they've got 11 more days to make that change for November. We can't do anything retroactively. So if you want to make that change for November, you have 11 more days to let Annalyn know, and probably you should let her know in 8 days. So she has time to do that. And then for December 1st, you just need to make sure you get in touch with Annalyn in November so she can get that processed for you. And then there are the other two boxes here. The red one is the COVID-19 Resource Center. So this is just a page on our website. It's at cpg.org/COVID-19, so it's really easy to remember. It's a good place to send your employees if they have questions about COVID-19 and their benefits and how that all interacts with CPG. You can find information from our CEO. Any updates get posted to that page. And then the gray box is the administrator FAQ, the COVID-19 administrator FAQ. And you can find a link to that at cpg.org/ARC. And 99.9% of everything that I'm one of the account managers at CPG, and 99.9% of what we know about your benefits and how they relate to COVID-19, that information is found on that administrator FAQ. So if you have questions about testing and coverage, about pension waivers, all of that is contained on that page, that administrator COVID-19 FAQ. So we hope these resources are helpful. And there are a few other things that we'll talk about tomorrow in the member education, as far as how the benefits are working a little bit differently, how they've responded to COVID-19 in positive ways. So stay tuned for tomorrow, or there's your little teaser to join us tomorrow. The only change this year to the plans is that we've added enhanced hearing benefit for active members. So today, if you're a retiree, you have a hearing benefit, and we're actually improving that for retirees going into 2021. But if you're an active employee, you don't have anything except the Amplifon discount program. So beginning in January, we're providing a hearing aid benefit of a maximum of $1,500 per ear every 3 years. You only have 2 ears, so it's every 3 years. And this is integrated with your health plan. So previously, it's been an exclusion. Our plans excluded hearing aid benefits. We're removing that exclusion. So if you choose an Anthem plan, or if your employees choose an Anthem plan, they will be able to access hearing benefits through the Anthem provider network. And if they choose a Kaiser plan, they'll be able to access benefits through the Kaiser network. So we're really excited about this. It's definitely good news for everyone, especially those who need it. And other than that, nothing else with the plans is changing. So the same plans that have always been available, well, not always been available, but the same plans that are available this year will be available in 2021. There's no changes to deductibles or copays or coinsurance or any of that. The plan designs are exactly the same, will be exactly the same on January 1st as they are today. So keeping things simple. Any questions so far? Just kind of temperature check. Everyone doing okay? You can hear me all right? Okay. So let's dig in a little bit, and we're going to talk about the medical trust, the Episcopal Church Medical Trust, our pricing process, and what that means for the Diocese of Los Angeles. So the medical trust, Episcopal Church Medical Trust, is exactly that. It's a trust. And it's made up of all of the money that you all send in each month as your monthly contributions. It's not for profit. There's no stockholders. There's no, stockholders. But what we do is about 90 cents of every dollar that we receive in contributions, we pay out in claims. About 5 cents we give to our vendors so we can rent their networks, they push paper and process claims on our behalf and provide all of their services. And then about 4% goes to administrative costs at CPG that provides for things like me being able to give this presentation today and provide support throughout the year. Our client services team provides support too. And then about 1% goes into our reserve. So the goal is to, balance that to net zero, and not, have a reserve for a rainy day, but really we're trying to make sure that we're collecting an even amount that matches the claims. So on the left side of this slide, wait, I don't know my left from my right. On the blue side of this slide, you'll see the overall. And these are factors that we take into account for the entire Episcopal Church Medical Trust. So it's not just the Diocese of Los Angeles, it's all the dioceses that participate with us. And then on the green side, you'll see the factors that we consider just for each specific group. So I'll give a little more background on that. So for the entire group, we take a look at large claims, and we define large claims as any one claim over $50,000. And our fancy pants mathematicians have an actuarial estimate of what they think our large claims will be in a year, the expected large claims. And so that's based on our population, on our age and gender and geographic makeup. They calculate this number. And then we compare that number to what our actual large claims were. And we never want to penalize someone because they had a bad year, penalize one group because they had a bad year. So we try to spread that large claim risk around the church and just spread it like peanut butter. So we're all in this together. And then the other thing that we look at for everyone is kind of global projections. So how do we think that cost trend, which we're going to talk about a lot in the next few slides, how do we think that cost trend is going to be for the next couple of years? We know sometimes there's legislation, sometimes there's something like COVID-19, and what is that? How is the landscape around healthcare costs changing? And then we do stress testing on the whole fund, on the whole population, to see under different scenarios, do we have enough to get through the year without having to raise rates or do something that would make everyone sad, right? On the green side of the slide, you'll see the factors that we consider for each group specifically. So in Los Angeles, you have a churches group and a schools group. And we take a look at what we think our medical trust average increase will be, and then how you compare to that historically. So are your rates higher or lower than the average? Has your increase been higher or lower than the average over time? And then we look at your specific geographic and demographic factors. So that was, age, gender, where do you live, and how does that track with the cost of healthcare? And then we look at your experience, which is just a fancy or maybe not fancy way of saying claims. So what has your claims history been for the group as a whole? And then we look at your previous rate actions. So how have we changed your rates over time? And so cost trend is a big influencer in thinking about how we prepare for 2021 and 2022 so that we have enough money in the fund to cover claims. So cost trend is really just the difference in cost to provide treatment from one year to the next. And there are a lot of things that go into, a lot of influencers on cost trend. And two of the big ones that we'll talk about in a little more detail are inflation. So how has the cost for providing service X changed, or how do we think it will change between this year and next year? And then the other is utilization. So maybe this year I didn't go to the doctor very much because it was COVID-19 and it was hard to get an appointment and all of that stuff. And maybe in 2021, I'm going to go a lot more. So that's utilization and inflation. And more specifically, these are some other factors that can, I don't know more specifically, but to expand on that, these are some other factors that can impact cost trend. So I won't go through all of them, I'll just highlight a few. So health service utilization, we just talked about. Inflation or deflation, we just talked about. Variations in provider treatment patterns. So I have a veterinary example, which is not the same thing. I'm not confused about that. But my cat just got diagnosed with hyperthyroidism, and I kind of panicked and started Googling the different treatments, and one of them was surgery. So I was talking to my vet, and she was explaining the different options, and she didn't mention surgery. And I said, well, what about this surgery? And she said, well, there's a lot of really small glands and delicate tissues in his throat. So we don't really do this surgery anymore. It's not really recommended because it can have some downstream negative effects. So that's an example, and I know it's a veterinary one, but that's an example of how providers might move away from certain treatments in favor of others as time goes by and technology improves. And sometimes those new treatments are less expensive, and sometimes they're more expensive. It just depends, right? And so this stuff is all really complex when you get into it. Changing health of the covered, the other two green, I've got my colors wrong, but changing health of the population, COVID-19 might be an example of that. We're still assessing that, we're right in the middle of it, but you can imagine how that might have an impact. Impact of fixed deductibles and copays is another interesting one. So I mentioned at the beginning of the presentation that our plan designs haven't changed for a couple of years now. So what you pay today for a copay to see your primary care doctor or a basic non-specialist doctor is the same thing you paid last year and the year before and the year before, and it's the same thing you'll pay next year. But inflation does happen, right? So over time, as those costs stay fixed, your cost stays fixed, the cost of the plan can be increasing while it's not changing for you, it is changing for the plan. So that has an impact on trend as well. So these are just some examples. Legislation is another one that we talked a lot about back when the Affordable Care Act was brand new. And so you may be asking yourself, well, what do we think trend will be like for 2021? And so this information is not specific to us at the Medical Trust or you at the Diocese of Los Angeles, but this is what we're seeing on a national level. So nationally, medical cost projection or trend is anywhere from 4 to 10% increase for next year. And that uncertainty, that broad range is really due to COVID-19. We know a lot of elective procedures have been postponed, and we know that a lot of preventive care isn't happening today, but claims are also down. So that's why that spread is so wide. I said this on an earlier slide where we talked about utilization versus inflation, and inflation continues to be a larger factor than utilization. So people are not necessarily using their healthcare benefits more, especially this year. And then there are some inflators. So the COVID-19 mental health impact is a big one. I'm seeing more and more in the news about that every day. One of my coworkers shared an article this morning that said why working from home is making us all miserable, and there was a collective kind of miss people. So the COVID-19 mental health impact is a big one. Specialty drug spend continues to be a big factor for our population, especially, but also nationwide. And then chronic disease prevalence. So things like diabetes and heart disease all have an inflating effect on cost trend. And then there are some deflators, and I'm gonna go a little more quickly through these details, but telehealth is going mainstream, and so that's saving everyone, the plan and the individual, some money. Narrow networks is one way that some plans are cutting costs and reducing that. Our plans don't do that. The Anthem plans have a very broad national network, and then Kaiser, is kind of its own ecosystem, but we're not looking at narrowing the networks for 2021 or this year. And then the last thing I'll just point out specifically is the increase in benefits communication and navigation tools. So we've seen a big improvement or really initiative from both Kaiser and Anthem to make sure there's apps that you can download on your phone and have your ID card, and that's all really easy to use. Anthem has really done a lot to develop their care management program, which we'll talk more about in the member education session tomorrow. So trying to make it easier for people to engage with their benefits, to know, where they are and what they have, and be more active participants, that has a positive, a deflating impact on cost trend. And I think I saw something in the chat, so bear with me. What is elective procedures to preventive procedures? What is elective procedures to preventive procedures? I'm not sure I understand the question, but an elective procedure might be, what might an elective procedure be? An elective procedure might be a surgery to fix I had a friend, here's one. I have a friend who had her toe, she had like a joint fused in her toe this year. And that would be an elective. She could have waited, but she chose to do that this year. And then a preventive procedure would be your annual visit with your doctor and those age-appropriate screenings and testings and things. So we all have, I hope we all know, we all have preventive care included in our plan for free. So you have one annual visit for free. That's just your preventive visit with your doctor, and that would include age-appropriate screenings as well. So I hope I answered your question. If not, feel free to unmute and raise your hand. Does anyone else have questions while we're pausing a little bit? Okay. So when the medical trust takes a look at our whole population and all of those factors that I just talked about, we estimate our trend for 2021 to be 5.7%, an increase on the medical side, and 8.2 on the prescription side. And that brings us to a composite of 7.1%. And then you can see the factors in blue are other inflators. So prior experience is claims. When we look at our claims history, we need to add a little more from that. And then demographic and geographic risk and benefit changes. So we're looking at a pretty high increase for 2021, and there are a couple of things to help with that. So the first is, cost containment strategy, economies of scale. This is something that happens every year, all year. We're part of a church benefits coalition, so we're able to leverage that to get better pricing with our vendors. And then we're quite a bit larger. We're not just the Diocese of Los Angeles, for example, we're the entire medical trust. And then in green, the one I really want to make sure you understand is this surplus. So as claims have been lower in 2020, and if you remember, I said we spend 90 cents on claims, 5 to our vendors, 4 on administrative costs, and 1 to reserve. So we found ourselves with a little bit of a surplus. And we also found ourselves with a higher trend than, and this would be what our average increase would be, a higher trend than we wanted for everyone, right? It's been a difficult year. So we've been able to take our surplus and reduce the average increase for the whole population by 2.1%. So instead of 8.5%, 9%, our average increase for the entire church is 5.44%. And so what does that mean for Los Angeles? And that is on this slide. So there's a lot of data here. If you want to just scoot over, and I'm sorry, I don't know which of my left or right is correct for you guys, but if you want to scoot all the way over to 2021, you'll see our average increase was 5.5% for everyone. And Los Angeles is falling above that. So the schools are in green and the churches are in blue. However, your increase this year for 2021 is lower than it has been for 3 years, so that's good news. And although your increase is higher than average, and I'll talk a little bit more about why in just a second, although the increase is higher than average, your actual rates are lower than our average, and you can see that in the bottom. So the church's rates, the dollar amount that you're paying each month rather, is 12.404% below the medical trust average. And for the schools, it's 26.1% below the medical average. And I see a question in the chat. Someone asked, what is the DHP? And DHP stands for Denominational Health Plan. So this was a resolution that was passed by General Convention back in 2012. So the medical trust exists because the church created it back in 2012. And so that is just a shorthand for everyone in the medical trust. So not just the Diocese of Los Angeles, but all the Episcopal dioceses and institutions that participate with us. So the reason, I'm sure you're wondering, the reason for the higher than average increase in Los Angeles really comes back to those green factors. So your claims history, you just have more claims. So we are paying more from the trust for your claims than we're getting from you in contributions. So we have to try to balance that out. Other dioceses and institutions are helping to support the Diocese of Los Angeles, and that's fine. We know claims are cyclical, and that's part of what the DHP is designed to do. But we have to make sure that we're trying to balance that as best as possible. So your rates are higher than the average because your claims and costs here are a bit higher than the average. And so someone else is asking in the chat about the increase. And yeah, so the parishes will see an average of 7% increase for their rates for 2021, and the schools will see an average of 7.4. And there's a little bit of variation depending on what plan you choose, but that's the average increase for everyone. And then let's see, I'm reading the chat. There's a question about telemedicine. So will telemedicine be included in preventive care moving forward? Okay, so good news on telemedicine, and I am going to talk about this tomorrow, but it's important, so I'm happy to go into it now. Today, we have Anthem and Kaiser, and they each have their own telemedicine platforms. So Kaiser has a Kaiser platform, and Anthem has one called Live Health Online. If you see a provider through that platform, so you log into Live Health Online, you don't get to pick your doctor. It's kind of like Uber. You don't pick your driver, you just get a car, and they come and get you. So you'll see a doctor through that platform, and whether it's COVID-19 related or not, that visit is at no cost to you. So it should be at no cost. And if there's an error, definitely reach out to Anthem or our client services team, and we can take a look at that. But that's at no cost, and that's through the end of next year. So you may have received communication earlier in the year that was only through the end of this year, but it's going to go through the end of 2021. That it could be extended for all I know, but it may not be. So, but through December of 2021. We also have changed our coverage around virtual visits. So these concepts are really similar, right? Telemedicine and virtual visit. Telemedicine is through the platforms. Virtual visits are visits that you would have with your doctor through maybe their own platform. So maybe they will meet with you through Zoom. In the past, that wouldn't have been covered. We would only cover you for an in-person visit. Going forward, and again, through the end of next year, those virtual visits with your providers will be billed as if they were in person. So as long as you're staying in the network and seeing your network provider, you'll pay your network copay to see your doctor virtually if you meet with them through Zoom. So I hope that answers any telemedicine questions. Does anyone else have questions about the DHP or rates or... We've got time. We're doing well on time. Okay, so I'm going to continue. This is just a summary of dental rate changes. So, so the churches are in blue and are along the blue curve. Schools are green, and then the medical trust, or the DHP, is in purple. So you'll see for the churches, it's very similar to last year. For the schools, it's actually a much lower increase for 2021 than it has been. And then for the medical trust, you'll see this is what the average dental increase was for the different plans. And keep in mind that, you know, the 0.91% increase in the preventive plan in most cases works out to about $1, because the dental rates are lower, particularly on that preventive plan. So, any questions? I know I just asked for questions. Oh, and there was a question. Do the virtual visits cost the same as in-person visits? And the answer to that is yes, as long as you're staying in the network. So if you're seeing a network provider and you would have paid $25 when you went in person, you'll pay $25 to see them over Zoom or a platform that isn't one of the ones provided by the providers. And now I believe Kaiser has a little bit different requirements, so it's a little bit tighter with Kaiser.
Courtney, it's Robin Kasabian from St. Mark's in Van Nuys. I'm wondering about that because the level of care and the amount of assessments that are completed in a virtual visit are less than what you would have as in an in-person visit, vis-a-vis weight, temperature, blood pressure, and any other physical examination. And so I was just curious if that costs the same as it is to talk to somebody on the phone.
So virtual visits, remember, didn't used to be covered at all.
Right.
So I hear what you're saying, but no. So if, the level of care is a little bit different over a computer screen than over the phone. You would still pay the copay that you would have paid if you had an in-person visit. But a year ago, you would have just had to pay for that out of pocket completely.
All right. No, I'm delighted that it's covered. I just mean in terms of negotiating cost for the trust, it seems that the actual cost of the visit should be less because you're not having the services of a medical technician to check vital signs and whatnot.
Yeah.
I was just going to that point. I realize that's out of my wheelhouse, but it was a thought that occurred to me.
No, that's a great point, and it's out of my wheelhouse too, but it's a good question, and I don't know, I know what your costs are, I know what my costs are if I do that, but I don't know what the plan costs are. So the doctor may bill that differently to the plan, and I'm not sure about that. So that's a great point. Thank you. Okay. So let's shift gears a little bit and make sure that you know what you need to know for annual enrollment administration. So I just want to start with this slide to kind of frame how we work together, where our job starts and ends and where yours starts and ends. And some of this is a little fluid. It's not meant to be a harsh, a harsh thing at all. But I'll start on the right side of the slide. I don't know why I thought I didn't know my right from my left. It's the right side of the slide. Anyway, start with the right side of the slide, which talks about church pension groups' responsibilities. So we are here to provide education and information and resources. So that's things like this program and my work with Annalyn. It's our client services team, it's our website, it's and all of the information that's on our website, both for members and administrators. It's conferences and webinars and all of that good stuff. And then we're here to assist with our systems and with process issue resolution. So we know that sometimes something goes bump in the night, and we wish that we wish that didn't happen, but we know that it does. And so we're here to support you when that happens as well. And in many cases, your first step will be to reach out to client services or to Annalyn, and then Annalyn often brings those things to me so that I can help get involved and get those things resolved. And then the last bullet is about collaborating to address your benefit needs. And so Annalyn and I and the insurance committee and the diocese meet a couple of times throughout the year. Annalyn and I are in regular communication to identify ways that we can support the needs of the Diocese of Los Angeles differently or better. And one example of that is your unemployment insurance through the diocese is something that we help administer. And y'all are the only ones we do that for. And that was in response to something, a request and a need that we thought we could fill. So that's our side. And then on the other side is your responsibilities as administrators. So it's up to you to understand and adhere to our policies and procedures. So that includes things like eligibility requirements and timely enrollments and terminations and things like that. And of course, if you ever have questions about this stuff, our client services team is there to support you and answer all those questions. We also depend on you to educate your employees about their benefits. We have opportunities like now during annual enrollment to educate members, but day to day, when you hire a new employee or if someone has questions about their benefits, we rely on you to help. And again, our client services team is there to support where there's a gap for sure, but that we appreciate your help in that a lot. We rely on you to comply with your federal and state laws and regulations. And particularly in California, I grew up in California, I live in Texas now, but you have a lot of special considerations around employment law in California, and we cannot pretend to be experts in that. So we count on you for that. And then we count on you to make timely contribution payments. And like I said, when I was talking about the 90-day grace period, if you ever find yourself in a situation where that's a challenge, please, please, please just reach out to our client services team. They want to help find a way to make things work. So hopefully that's review, but just every couple of years, I want to remind everyone. And you'll notice, let me just go ahead and build this out, that we're almost to the end of this timeline. So we're here in October, on October 20th, and you in the Diocese of Los Angeles are in session 2 for annual enrollment, which starts on October 28th and goes through November 18th. So that's honestly the most important thing for you to take away from this slide. All of that work that I talked about trend and pricing happens between January and July. During August, our diocesan administrators and insurance committees make decisions about what plans will be offered. And then in December and January, we're working with the vendors to finalize enrollment lists and make sure everyone gets their ID card so that when January 1st comes, they're ready to hit the ground running and get healthcare that they need. So just to reiterate, the annual enrollment runs in Los Angeles from October 28th through November 18th. And all of your members will receive a green envelope in the mail, as they always do. It's a little bit larger and slicker this year. And those were mailed out on October 14th, so last week. So you may have already received yours. Your employees may be starting to receive theirs. And this letter contains instructions for how to log into our website and make plan selections. The example on the screen shows what it looks like. It includes their client ID number, so if they haven't set up their MyCPG account, they can log in and they can create their account and log into it. They can also contact client services if they're having trouble logging in, which is easy to do, right? This might be a password they're not using all the time. So if they get stuck or locked out, just pick up the phone and client services can walk them through the steps to reset their password and get logged in. And this is the same login that you would use to access your MyCPG account. So at any point in the year, you can log in and look at your personal benefits. Your employees can log in and look at their personal benefits. And it's also the login that you would use when you wanted to access the employee roster. So it's all tied to you, which is a really good reason why you should make sure not to share that with, with coworkers who want to do work in the employee roster. Make sure they have their own logins as well. So any questions about annual enrollment, what you need to know? We always encourage, and there's some questions in the chat, so I'll get to those in just a second. We always encourage people to log in and make sure their information is correct, even if they think they're not making a change to their plan. You can ask Annalyn. Every year she gets calls after annual enrollment is over with people saying, oh my gosh, I forgot my dependents. Oh my gosh, I forgot my address is different, or I don't want to be in this plan. And so it makes her life a lot easier, and your lives as administrators a lot easier if you can just remind your employees and yourselves to log in and double check everything and make sure it is what you think it is, so no one has to clean up. Mm-hmm. Yeah.
If when they log in, and the information they will have on the annual enrollment page would it automatically have their dependent that they have currently enrolled, or do they have to make sure that they click the button to enroll their dependent?
Your dependents that are already enrolled will show up on the plan for you. So when a member logs into the annual enrollment screen, if they have dependents who are already enrolled, they will see those names. So if they want to add someone, maybe they had a baby, or for some reason maybe a spouse lost coverage, or for whatever reason they're adding a dependent, then you would have an opportunity to add a dependent at that point. But your existing dependents should appear in the annual enrollment screen. It's a great question. Do employees who don't choose to have medical coverage receive a packet? That's a great question. So, and reminded me of something I skipped. So if you have employees who have declined coverage in the past, they will not get this mailing. This mailing only goes to folks who are enrolled. So that's important as an administrator to make sure you have kind of check in with those folks again and make sure that they understand what decision they've made. And also the mailing list for this freezes each year in August. So this year it froze on August 14th. So if you hired someone after August 14th, or to be on the safe side after August 5th, they may not receive this mailing, and you'll need to reach out to Annalyn and work through their annual enrollment manually with her. Also, if someone moved between August, it froze on the 14th, but sometimes it takes time to get things in systems, right? So if someone moved between now and August, or between the end of annual enrollment and August, their mailing will go to their old address. And so if things aren't set up to forward properly, or if it's been too long, they also won't receive the mailing. If it's that latter case, as long as they have a client ID, they can still call client services. So even if you haven't moved and you're not a new hire and you lost the envelope, you can call client services and they can help you get logged in. But new hires are since August are ones you'll want to reach out to Annalyn about.
Courtney? So the enrollment forms can be downloaded from like what Courtney was saying. If you have employees who waived last year, so they're not going to be getting a packet, and so I need to do a manual enrollment for them. The enrollment form is available in our website, and Courtney will share that shortly. All the information that you will be needing as an administrator are actually in our diocesan website. When you log into our diocesan website, on the right side, you will see a menu selection. You go to Human Resources, and under Human Resources, you will, Courtney showing you right now. Under Human Resources, you'll see right there, Employee Benefit. And so all the forms that are needed for termination, for enrollment, for making a change, will be here, and the materials are also all there. The benefit rates are also available. So you can download that, whether you're a church, you need a church rate or a full rate. Thank you, Courtney.
Absolutely. It was perfect timing. I love how people's questions honestly always seem to be perfect timing for the next thing that we were going to do, because this was next. So exactly this website, y'all are really lucky in the Diocese of Los Angeles that you have Annalyn keeping an eye on this and providing all these resources at your fingertips in a place that hopefully you're familiar with. So you can find the rates here and all the forms that she said. And the other thing that I want to go through at this point, and here's the little title screen, is I just want to give a high-level overview of this health benefits information booklet. So this is something we put together every year. Anna Lynn and I work together to put this together. And I'm not going to go through every page because you would all fall asleep, but I want you to have an idea of what's in it. So so the first thing is a medical plan comparison chart, and it's going to show all of the plans side by side so you can compare copays and deductibles and out-of-pocket maximums and how much does diagnostic testing cost across the different plans. And then for more detail, we included the summaries of benefits and coverage for each of the plans. And all of this information in this booklet is also on the website that we just showed you. But maybe you're a booklet person, so it's nice to have it all in one place too. You can just print this out and share it with your employees if you want to, or email it to them, which is better for the environment. There's also information about Anthem's telemedicine here. I realize my screen is a little bit in the way, so I can't see what's below that. So we'll do it this way. I want to try not to make everyone dizzy. So there's information about telemedicine. There are fact sheets about CDHPs and health savings accounts, which are really helpful for members who, particularly if they're interested in a plan like that for the first time, as well as a brochure about investing your health savings account, because once it gets past a certain level, you can actually invest it and earn money, and the earnings are tax-free as well. All of the dental information is included. The more in-depth summaries are there, as well as the vision summary, and then flyers and handouts and information about all the additional benefits. So again, we'll talk in more detail about all of this tomorrow in member education, but the Employee Assistance Program through Cigna, the Health Advocate, the Amplifon hearing discounts, and the United Healthcare Global Assistance. Then there's information about disability insurance, and both short and long term. Those are employer paid plans. And then at the very end are the regulatory notices. So these are things that as employers, you're required to give to your employees every year. So this might be an easy way to make sure you check off that box, is just to send them this booklet so they get those notices. And we will look a little more at this is just an SBC, and we'll look a little more at this tomorrow in member education. But I do want to just point out that the scenarios on the last page are the same for all the plans. So there's 3 different examples of healthcare scenarios that may come up, and what the out-of-pocket costs will be. So this is I find this to be a really helpful tool to try to understand how the plans actually work and what the out-of-pocket costs, how that's impacted by what choice you make in the plan. So there's a bunch of questions in the chat, and let me make sure I don't miss it. The website for the booklet is diocesela.org/employee-benefits. But you can also just go to the homepage, click on the little hamburger menu, scroll down to Human Resources, and then there's the Employee Benefits booklet.
Courtney?
Mm-hmm.
Courtney?
Yes.
While you're on it, if you click on that, go to the section for the health benefit comparison chart, just so
yes,
you show that to them.
Yes.
So inside the booklet that Courtney has shown you, which was the healthcare benefits booklet, this is included. But we have specifically put this comparison chart, something that your employees can look at, because it gives them an overview of all the health plans, the choices they can make, and what are the, and compare what are out of the pocket cost to them, and when they look at the premium, and so it's just good to have them really handy to show to your employees. So the information on this website with employees.
Thanks, Annalyn. And this chart is also in that booklet, so so you can get there 2 ways, and it includes the Anthem PPOs on the first page, the Anthem CDHPs on the second page, and the Kaiser plans are all on the third page. And then there's also prescription drug benefit comparison for both the CDHPs with Anthem, the PPOs with Anthem, and then the Kaiser plans all have slightly different prescription benefits and copays. And then a summary of the vision benefits is there as well, and dental benefits. So it's the Cliff's Notes of benefits options. And so let me get back to the chat. I know there's a bunch of questions in here. So let's see, we have a question about the employee roster. So I'm going to come back to that. So there's a question about whether or not to expect premiums to go up and for deductibles and out-of-pockets and copays to stay the same. So for 2021, that is the case. So monthly premiums are increasing for 2021, and deductibles and copays and out-of-pocket maximums are staying the same. I can't say, because this is part of the review that happens from January to July every year, that will always be the case. There may become a time when we have to take a look at the copay structure and change it. We'll always, try to let you know as far in advance as possible that something like that is on the horizon, but it isn't for 2021. So for 2021, copays and deductibles and out-of-pocket maximums are all staying the same, and coinsurance is staying the same. And we put a lot of thought into when to change and try to keep things as stable as possible. So I hope that answers your question. We already answered the one about folks who declined coverage, and we got their rate sheet. Okay, we have a question about long-term disability. That might be a little bit of a separate offline one, but I see that. So can you talk about options for employees who are Medicare eligible? And I don't have slides about this, but I can certainly share some information and with Annalyn, who can distribute it to all of you as well. So we have, go ahead.
So if you go onto our diocesan website, we have the information there.
Do you have that fact sheet? You're amazing.
Medicare secondary payer right there.
Yes. Yes, this section here, right?
Mm-hmm.
Yes. So there's another fact sheet which I'll send to Annalyn, and I think it's called something like medical plan options for employees who are 65 plus, something really catchy, and it goes through each of the options. So there's a couple of things that are really important. One is that employers cannot provide any incentive for employees to go on Medicare. It's very not, the government gets very unhappy if you do that. So employers cannot provide any incentive whatsoever for their employees to go on Medicare. In that vein, if an employee is on Medicare and is on our Medicare supplement plan as a retiree, and they come back to active employment, and they're eligible to participate in an active medical plan, they cannot continue to receive the subsidy and stay on our Medicare supplement. That is an incentive. So that's real important to be aware of as well. The Medicare Secondary Payer Small Employer Exception is a fantastic program if you have fewer than 20 employees. So those of you who have Medicare eligible employees and you have 19 or fewer employees are eligible to participate in the Medicare Secondary Payer Small Employer Exception program. And that's what these forms and fact sheets are all about. And basically what Medicare says is, okay, if you're a smaller employer, then Medicare can pay primary, and the private health plan through the medical trust can pay secondary. And that means you can save about 20% a month on the premium for those plans. So I know it's kind of high level. I'll make sure Annalyn has that bulletin to share with you all about the kind of outlines the different options and rules. Yeah.
Can you show them the rate sheet on the church site so they can see the difference in the
Yes.
premium?
Yes.
And can we make that bigger? There you go. So on this rate sheet that you will see, the active plans for those who have employees more than 19 and above would have to be enrolled in here. If you have an employee, you have 19 and less employees during the year, and you have someone who is Medicare eligible still working, they can have Medicare Part A and then still be enrolled in in any of these plans up here, but get a reduced rate, right? So there is a major discount, and the reason for that is because Part A, Medicare Part A covers hospitalization, and it will coordinate with your Anthem Blue Cross Blue Shield plan. There's no Medicare secondary payer plan for Kaiser plan. Only the Anthem Blue Cross Blue Shield plans has it. So if you have someone who is Medicare eligible and you have 19 employees, this would be a great saving for your congregation. And the forms for this are on the website, but you can definitely connect with me and I will tell you exactly what to do with it. Thank you, Mark.
Thank you. Thank you very much. You are in excellent hands with Annie. So I think we answered this one, but if someone has a CPG login and they can't find their green envelope, they can still log in and make their selections without the green envelope. And then the rate sheets are posted on the website. We have a question about that. There are, I'm gonna punt this one to Annalyn because each diocese does it just a little bit differently in terms of record keeping. But there's a question: employees who don't choose to have medical benefits through through us, through their church employer, are there forms that need to be completed during annual enrollment? And there are only a few approved opt-out reasons, and each diocese kind of tracks that differently. So I'll let Annalyn take that one.
So depending on what, right now, pretty much our diocese benefits are employer paid. The cost shares are different per congregation or per school, and you declare what your base plan is. And base plans can be as low as the PPO 70 plan to the 100 plan. And so if you are paying for your employees' benefits, you cannot discriminate, as just like Courtney was saying. If you're paying it for your clergy, then you have to pay for your lay employees because they are all basically your employees. Now, if there's really a legit reason why they need to waive their medical or dental plan, on our website, again, the enrollment and change form, they can officially waive it. And so download that form, upper somewhere there. Yeah, if you looked at this form, under the medical and the dental selection, there is a way for them to waive the medical and dental that you're offering to them. But as Courtney said, it needs to be a legitimate waive. I hope that answers the question. And if that doesn't answer the question, please email me.
Here's the form.
It's a form, and it's that very low. There's the decline section for that on the dental and on the medical section. See right there.
Dental coverage. Sorry, thanks. Dental coverage declined and medical coverage declined.
Mm-hmm. And the reason why they have to decline it is because you're supposed to be paying for it and they don't want it. So you need to make sure that you are legally covered, that your employees are actually declining it, even if it's supposed to be employer paid benefit.
Thank you so much, Annie. So we have a question about vision and vision is through IMED still, so that hasn't changed. We'll talk about it tomorrow in member education, but you do have a free eye exam every year and $150 allowance toward glasses or contact lenses. There's discounts for other things as well, but that's kind of the high level, most important part. Let's see. The Medicare secondary payer eligibility certification does have to be filled out every year. And in fact, if you have 19 employees and you hire that 20th employee and you expect them to continue, you need to get in touch with us and let us know that you don't meet the Medicare secondary payer small employer exception eligibility rules anymore as soon as you become aware of it. We have a question. Is it mandatory for employers to enroll employees and the short and long-term disability insurance as well as the unemployment insurance? And that is another good segue to our next section. So I'm going to click through on the presentation and give Annalyn the floor again to answer that one.
So the church organization in reality were exempt to offer disability and unemployment, but our diocese requires it. So that's the reason why we provide short-term, long-term disability and unemployment, and we have a private provider for it. However, in our diocese, we allow our congregations and our schools to choose between going through the state program or through our private program. So the answer for our diocese is you have to offer them.
Okay, and then one last question from the chat, and then we'll go back to the presentation and take a few more questions at the end if there are more. Is if employees don't want to change their coverage, do they still have to re-enroll? And so it is a passive annual enrollment this year, which means if you do nothing, your current selections will roll over into 2021. But we do really highly encourage everyone to log in and double check everything. So if they don't, their coverage will just stay what it is.
Courtney?
Yes.
I just want to cover, there was a question about health savings account funding. So if your employees are enrolling in a consumer directed health plan, any of those plans, the employer is supposed to fund half of the annual deductible. So it still is the same, and I think that was a question from Melissa. So it still is the same, because you will notice when you look at the rate sheet later on, we've been through it before, but Courtney needs to do her presentation, and we will probably be going over time. So you will notice when you look at the rate sheet that the consumer-directed health plans are way cheaper in terms of premium. And so it's saving the church money, but for them to enroll in that, you need to fund half of the deductible of that plan. And where do you know, where will you find the deductible of the plan? Again, when you look at that big comparison chart that, that we have provided on the website, you will see under the CDHP plans, what are the annual deductibles. And so you will have to fund an employer funding for HSA will be half of that annual deductible.
Thanks, Annalyn. And we can, I guess I said at the beginning, I don't think we'll need the whole hour and a half, but I'm happy to keep answering questions as long as you all still have them. So, so let's get through the tail end of the presentation. We're almost done, and then we can go back to questions. So just as we have, we're going to talk about disability a little bit, and just as we have annual enrollment for the medical plans, there's also an annual enrollment opportunity for the disability plans. So this is rare and important to be aware of. The expectation is that if you have one eligible employee enrolled in a short or long-term disability plan with us, that all of your eligible employees are enrolled in that plan. So you can't just enroll organists. You're expected to enroll organists and youth ministers and other lay employees in those plans. And clergy can be enrolled in the long-term disability plan as well, but not the short-term disability plan. Anyway, so the annual enrollment period for disability is October 12th, so it's already started, through December 18th. And in most cases, if you're participating, if you have any employees who are participating in the plan, everyone should be in there as well. But sometimes maybe an administrator changes, or for whatever reason, someone missed the window when they were hired. So you have 30 days from the time you hire someone to enroll them in a short or long-term disability plan. And for a variety of reasons, sometimes people can get left out, and that's just life. So this is the opportunity for you to capture those folks who might have been missed and make sure they get enrolled. And you can do that by filling out the enrollment form from the website and sending it to Annalyn so she can get those people enrolled. If you wait until after November 18th, it will be too late. So just be aware that that's happening. And then I have 2 slides just to kind of summarize the benefits. There's more detail about the disability plans in the health benefits information booklet toward the end. But the short-term disability plan is pays a 60% of base pay, really of compensation. Base pay is kind of anyway, really of compensation, up to a maximum of $1,500 a week. There is a 14-day elimination period, and that lasts for 13 weeks. And then you can see the rate at the bottom. This rate is the same for 2020, 2021, and 2022. So we got the rates locked in for 3 years. And then if the disability continues past the 13 weeks, then they would transition to the long-term disability plan. And that has a monthly maximum of $7,500 a month. And all your employees who work a minimum of 20 hours per week are eligible. So for the medical plans, it's 30 hours a week or 1,500 hours a year, but for disability, it's only 20.
Courtney,
Mm-hmm.
I just like quickly to add that if you're enrolled in the short-term disability under the state plan, and then of course you enroll in our long-term disability program, if you have an employee who exhausts their short-term disability through the state, then they can enjoy this long-term disability plan.
Thank you. And then, right on time, someone in the chat is asking about life insurance. And I don't have a slide for it, but I was planning to talk about that here. So you may remember, if you came to one of these presentations last year, that we talked about the one-time opportunity to do a catch-up for life insurance. And that's still something that we're working on. COVID-19 kind of threw a wrench in the gears for all of that. But there is still going to be that one-time opportunity to capture folks who might have been missed. For life insurance, you have 60 days from the time you hire someone to make sure that they're enrolled. And we know that there are places where where we have pockets of folks who didn't get enrolled the way they should have been. So Annalyn and I and others at CPG will be having conversations in November to work on those details. And then I'm sure she'll be reaching out to all of you to make sure that we know all of the folks who might be missing. And then what we'll do is we'll have a new set of people, the existing people plus these folks we've missed, and we'll send that to our team, and they will take a look and analyze that and see if there's an adjustment that needs to be made to their rates. And in many cases, particularly when there are school employees that have been missed, the rates will go down. If the new folks are a little younger and a little more female, the rates will go down. If their new folks are a little older and a little more male, the rates could go up a little, but it should be subtle either way. And we'll work on that and definitely give the diocese some options to choose from before we move forward on that. So just a heads up that is coming. If you thought you missed it, you haven't missed it yet. There's still time. Anything you want to add to that, Annalyn?
So, group life policy is an employer paid benefit for our diocese. We have passed that resolution in our diocese in 1992 to provide a group life policy for our employees. So that is also employer paid. So I just want to reiterate again, short-term, long-term disability, if you're participating in our plan, our employer paid program, that's what we signed up for. Group life insurance is employer paid, and also the unemployment.
And one of the things that we know happens all over is that sometimes someone will decline, a new hire will decline medical coverage because maybe they have coverage through their spouse, which is one of the approved reasons to decline medical coverage. And so then you might think that you don't need to do anything, but you still need to let Annalyn know that you have this new hire so they can be enrolled in disability insurance, in life insurance, and in the unemployment insurance. So just because they're declining medical and dental doesn't mean there aren't other benefits that they need to be enrolled in. Okay. And timing on the life insurance, you know, the kind of if there's new rates and all of that, really just depends on Annalyn's availability and our availability. We got to get through annual enrollment first. So hopefully in the first half of 2021, we'll have that. There's a lot of moving pieces there. So I'm sorry, I can't give a more specific estimate. And great reminder in the chat, someone points out, don't forget that you can add someone to just the Cigna Employee Assistance Program only, even if they decline medical. So that's a really great benefit. That's a household benefit. So even if their family isn't enrolled in that plan with them, they can still be enrolled in the EAP only, which is $4 a month. And that's an employer paid benefit always. Okay, so I just have two more things to share with you, and I hope this is not new information, but it's how we're here to support you, how specifically our client services team is here to support you. So as administrators, you have access to the dedicated administrator line for our client services team, and that number is here on the screen. And then you can also access the Administrators Resource Center at cpg.org/ARC, A-R-C, and you'll find a lot of information there about conferences and webinars, as well as any mailings that we send out, whether they're to administrators or to members. You can find them there. That's one of my favorite things. When I can't find a mailing, I go to our website to look for it. There's contact information as well for us and for the church insurance folks that you might work with. And then you can also email client services as an administrator at admin-assist@cpg.org. And this is your dedicated administrator number. So if your employees have questions about their personal benefits, there's a different number for them. This is your secret bat phone. And then there is an at-a-glance contact card for both members and administrators. And I'd like to take just a second and show you where that is. If you go to cpg.org/ARC, and it loads, you'll see here for admins, for members, the at-a-glance contact card. And it's this handy dandy, it's designed to be printed double-sided and cut in half. But you can just scroll if you don't want to print it. But it's this handy dandy card that has all of the contact information for CPG and all of the vendors that CPG works with. So Fidelity, Health Equity, Anthem, Kaiser, everyone, Cigna, IMED, it's all on this card. So it's great for you to download the administrator card, which has all the admin contact info, and to share the member card with your members. And so we had a question, I haven't forgotten, there was a question about the employee roster, and if we could talk more about the employee roster. And this session is really more designed to focus on benefits and annual enrollment than the employee roster. Annalyn, do you think, we can certainly set up something to talk about the employee roster at another time. You're welcome to call client services and they can provide support with the employee roster. Maybe you have a more specific question that I could answer, or maybe Annalyn wants to address that.
So I actually, the only thing why I put that in there is that we need to remind everybody that you need to update information in the employee roster. So I take care of the enrollment, and you send me the enrollment form after annual enrollment. Anyone that I need to take care of, I will I will be handling them manually. If they are a new hire, you need to make sure that their information are entered first in the employee roster. So this is basically a reminder. So if you sent me the form, but you haven't entered them in the employee roster, I will not be able to enroll them in the system because I wouldn't be able to populate their information through CPG's database system. So always start with the employee roster, input all the information, and then send me the enrollment form so that I can, actually take care of the enrollment. And then if there are terminations, because these are the most common questions I get throughout the year, if there are terminations as well, make sure that you have remitted the last pension contribution first before you actually remove somebody in your employee roster. So it's important to actually look at the employee roster and make sure that you still have all the employees that are supposed to be there, and you have actually removed the employees that have actually terminated employment. So the other thing about that is the most common question I get about the employee roster. Do I have to send in a paper enrollment form for the pension enrollment? So the employee roster basically takes care of that already. So you don't have to you don't have to send in the paper enrollment form. So if there are any salary changes, like, if there are salary increases during, next year, then you have to go into the employee roster and make the compensation change. If at any time in a given month or day of the year, there is a salary change, either a reduction or an increase in pay, then you also have to go back into the employee roster and enter the salary information. Because, and part of that is, right now, our short-term, long-term disability and also our unemployment, they are salary rated. So if we do not have the accurate salary information on your employees, then we will not be charging you the correct amount. So one of the things that happened during this pandemic is when some of the employees had been terminated, they had old salary information in the employee roster, and that's how CPG has been billing for it. And so when I get the employer, the employee application, I send that to our processor, which is in the Bay Area. So CPG collects the premium, but we own the plan. It's our self-funded program. And our processor is actually in the Bay Area. So we send that to them, and it's the 501c company. So they send out the employer verification to the employer, and then they will verify the salary information, and then they will verify that with me. If they have contradicting information, then we cannot pay based on the most recent salary if what we have is actually not that salary information. So it's just really very important to make sure that salary information is updated on the employee roster. I think that's pretty much what I would like to cover on the employee roster. And if you have any questions about that, let me know.
Thanks, Annalyn, so much. And I would add, I would say everything Annalyn just said again, but I would also add that you can enroll your employees in pension. Clergy are enrolled in pension through the employee roster, and lay employees can be enrolled in their lay DC plan or in the RSVP plan for clergy, if that's if they'd like to participate in that. They can do that through the employee roster. When you terminate someone in the employee roster, you are only terminating their pension and their employment at that institution. So it's important that you let Annalyn know that you've done that, so she can terminate their other benefits: medical, dental, life, disability, short and long-term disability.
Oh, thank you for mentioning that, Courtney.
Mm-hmm.
So that's very important, actually. So some of our administrator assumes that when they terminate the employee in the employee roster, all their benefits are totally terminated for them. And we have many cases like that, where they had forgotten to send me the termination forms for the medical, dental, group life, unemployment, and disability. So I still need to get that form because they're two separate systems. for to handle the enrollment and changes on the non-pension benefits. So I still need to get the form to terminate or change on the other side. And also new enrollment. So if you have entered them in the employee roster, do not assume they are automatically enrolled in the benefits, because we cannot make assumptions what health plans they will be choosing. So really very important information. Thank you for adding that, Courtney.
Absolutely. All right. So our chat has gone a little quiet, which makes sense because we're approaching 5:30. Sorry, 2:30. But we have 5 minutes left. So does anyone have other questions, or is there anything that you were hoping we would talk about that we didn't get to? Okay. Well, good. Well, I did say I would get you done early, so 5 minutes isn't as much. I'm going to go ahead and stop the recording and say thank you.